My name is TIWARI, and I'm going to talk today about evaluation of trust between patient and dental care providers. So why are we doing this study? This study is going to, so trust is a very important component of better oral health outcomes, patient compliance, patient satisfaction, disclosure of personal information by the patient to the dentist, utilization of care, and also beneficial health behaviors. Trust is affected by several factors, such as cultural factors, health literacy, perceived discrimination, and also inability to speak a common language. So in this study, we looked at the level of trust between patients and their dentists, and also we did some evaluation to measure if there was any racial ethnic differences between patient-provider trust. We used a cross-sectional study and used the dental trust scale, which has been developed and on the basis of the medical trust scale that has been used for several years. Our inclusion criteria was that the patient should have seen the dentist within the past 1 year, should be over the age of 18, and we had about 150 participants enrolled in the study. We also collected some information on demographics like age, gender, level of education, dental insurance, and annual household income. We also asked how did the individuals feel about their oral health and general health, and did they have a regular dentist? We ran ANOVA and F-tests for the statistical analyses, and also tested the association between the dental trust scale, mean scores, and some participant factors, including insurance, having a regular dentist, and oral and general health rating by the patient. While we were doing this study, the COVID pandemic happened, and we collected the sample between April and June, and that we considered during pandemic sample, and we did some analysis to see that during the pandemic, was there any changes in trust between the patient and the dentist. So the mean age of our sample was about 28 years. We divided the participants as self-reported by being white, African American, or Hispanic. The overall survey mean for the DTS was between 2.9 and 3.9, which reflects a high patient-provider trust. Overall, high trust reported by participants who had a regular dentist, and also even in the Hispanic patients we saw, if they had a regular dentist, they did report a higher trust in their dentist. And the sample that we collected between April and June, for that we saw that participants who reported excellent general health actually had better trust in their dentist. So I think the conclusion that we can draw from the samples is that having a regular dentist and reporting a good general and oral health actually improves the trust in dentist by the patients, as reported by the patients. Thank you so much. And the project was actually funded by DentaQuest Partnership for Oral Health Advancement.